Hi, I'm Dr. Brad Jacobs. I'm a member of the Integrative Health Advisory Board for Pharmaca, and we're going to talk about prostate health today. There's two topics I want to cover today: prostate cancer and enlarged prostates, or what I call BPH, benign prostatic hyperplasia. Prostate cancer to start with. Some of you may have heard there's some recent national guidelines that have come out saying that the blood test to check for prostate cancer, which is called a PSA, is no longer necessary and not helpful. You may have also heard there's another society that came out saying the opposite, saying actually we do think it's beneficial. And so at this point there's some controversy. I recommend that you speak to your doctor about this specifically, but I want to give you an overview about the subject matter to frame your conversation with your doctor. Prostate cancer. So the first thing you should know is that your rate of prostate cancer does go up as your PSA level goes up. But there is no specific value at which point your rate of prostate cancer goes up dramatically. So that's to say there's a linear relationship. It just keeps gradually going up, the chances of you having prostate cancer, as your PSA level goes up. There's no point where all of a sudden, above a certain number, your risk goes dramatically up. Nonetheless, guidelines were created that said the number 4 or greater, means we need to biopsy your prostate and look for prostate cancer. This was done decades ago. Ever since then, we've been testing everyone's PSAs. The national guidelines have come out and said, you know what, we're doing more harm than good. And I don't think we should continue testing for prostate cancer using this PSA test. And the reason is the harm are all the side effects that occur when you do a biopsy to check if someone has prostate cancer. Those harms outweigh the benefits in the view of the national guidelines. There's a urologic society that specializes in prostates that came out and they said, actually, we think we're saving lives and it's basically worth some of the harm that we're doing to save these people's lives. And so we think you should continue testing for prostate cancer using a PSA test. There's no right answer to this, and I think the right answer really involves you as an individual looking at your risk factors, your age, your race, and other risk factors that might put you at increased risk, and you should have that conversation with your doctor. I will say there's another conversation that you should also have to help frame this, and that is talking about what we say the velocity of change in the PSA test. And this velocity of change suggests that if someone's rate of change increases, so the PSA level is going up rapidly over the course of several years, then there might be a concern for prostate cancer, even if it's below the threshold of 4.0, which is considered the current cutoff for concern for prostate cancer with a test of the PSA. Now, this doesn't mean that everyone should get tested every year. And what it means is if you have previous tests that were done, it's worth looking at that rate of change. If you're talking to your doctor to decide if you should get PSA testing, the question is, number 1, should I get PSA testing thinking about prostate cancer with a cutoff of 4.0 and above? And number 2, should I get PSA testing thinking about prostate cancer, and we're going to look at the rate of change of my PSA test from 1 year to the next. Again, whether you should get PSA testing or not is a conversation you should have with your own doctor. The second topic I want to cover is an enlarged prostate. Many men, as we get older, we have to get enlarged prostates. And that affects our ability to urinate. We pee maybe 5 times a day instead of twice a day, and it's only half as much every time we pee. When we go to urinate, sometimes it's hard to get the stream started. For some people, it sort of dribbles. They don't have a full stream once they do start peeing. And this condition, or health event, if you will, is called BPH, or benign prostatic hyperplasia. And there's a range of medications and dietary supplements that you can use. There's also procedures that people can do as well, such as surgical procedures. But I'm going to talk today just about dietary supplements. And there's several herbs for you to consider. One is saw palmetto, usually dosed as a standardized extract at 160 milligrams twice a day. Another one is called pygeum, or Pygeum africanum. That is less well studied, but also shown to potentially be of benefit. Thirdly is something called beta-sitosterol. And beta-sitosterol is another compound worth considering. And finally is stinging nettles. These compounds are all been studied and with varying levels of evidence. The saw palmetto herb actually has over a dozen studies looking at it. although the most recent one, published in the New England Journal of Medicine, has shown that it was no better than placebo, many studies have shown a benefit. So right now, it's not completely clear whether this is a benefit or not. All these herbs are quite safe, and in my opinion, it's worth trying some of these herbs in consultation with your physician to see if it might be a benefit for you if you suffer from a condition of BPH. You may also go to Pharmaca. They staff with healthcare professionals there that are trained to talk to you about different herbs and different medications and your treatment options.